and outcomes since last 100 years. This session will be honored by our respected speaker, Dr. Muridhar Sharma sir. I am Dr. Parikshit Shrode moderating this session, and today's chairperson is Dr. Anand Vidyarthi sir. I welcome you all the participants. I am Dr. Shrode from Bododara, and I am introducing today's guest speaker, respected Dr. Muridhar Sharma sir. He has uh, passed his MS in Shalyatantra from BHU in 1982. After he joined SDM Ayurved College, Udupi, Karnataka, as a lecturer. Then he pursued at the same institute as reader and professor. He superannuated there, and now he is uh, professor emeritus there. He also performed as a superintendent of hospital of SDM UDP College Hospital. Presently, he is emeritus professor there. He is academic advisor of Nima Surgical Society. I welcome you, sir.
Okay.
Today's
Thank you.
session's chairperson is Dr. Anand Vidyarthi sir. I am also introducing Anand Vidyarthi sir. Uh, Sir has passed MS in Ayurveda from BHU, started his career with opening hospital in village as Ayurvedic surgeon. He also worked as professor in Government Ayurved College. He retired last year from District Hospital Gazipur. Presently, he is practicing as Ayurvedic surgeon in his own setup at Sakladia, UP. He is president of Nima Surgical Society, Uttar Pradesh chapter. I welcome you, sir. I think we should march towards next session. That is a lecture by Dr. Muridhar Sharma, sir. I am giving the speaker to Muridhar Sharma, sir. Please, sir.
Okay. Thank you. I hope I am audible and the screen is visible.
Yes, yes, you are audible and screen also visible.
Okay. Thank you. Now, thank you for giving me the opportunity to be with the such senior persons. And of course, I am not an expert. I don't think that I am really an expert to speak on these issues. But I am one of the person who is concerned about the development of the surgical discipline in Ayurveda as well as the medicine as such. Now, let me directly jump into the topic. The topic is about integrated medicine, though Dr. Raman Singh has suggested like success stories of 100 years. I don't know. I have not survived for 100 years, so I don't know like 100 years, but I'll try to share my experiences and my view on the integrated medicine as far as possible. Now, integrated medicine is defined by the WHO as ideally a combination of proven practices and methods of alternative medicine with conventional medicine. This definition came up in somewhere around 2000, year 2000 and 2001, whereas a definition of a integration of the medicine is more than 5000 years old, as mentioned in Sushruta, that Anya Shastropannanam Arthanam Iha Upanyitanam Arthavashat Tesham Tadviddebhya Vyakhyanam Manushrotavyam Kasmat Nahi Ekasmin Shastra Shakya Sarva Shastranam Avrodha Kartum. That's having the involvement of or inclusion of any other parallel science into the mainstream of what your subject is the real integration, and hence the subject of integration is more than 5000 years old, not simply 100 years. Now, as far as directly coming to the topic as such, from the current point of view, it's about the alternative medicine. Generally, native medicines are considered throughout the globe as alternative medicine, and WHO considers this as alternative medicine as such. The reasons for why the alternative medicine is being used still now, even if there is a advanced development of the contemporary medicine. This is one of the problem or question which many people have, and there is such as opinion surveys were done throughout the globe. One of the major surveys, I have just quoted the reference from one of the major survey, which has assessed from the public opinion like why the alternative medicines are used, and as per the perception of the common man, and as per the data, the patient feels or common man feels that alternative medicines benefit them significantly and they are safer. And of course the other reasons like dissatisfaction with the contemporary medicine, influenced by social network and so on, or tradition, these are all comparatively minor issues. The major two issues why the people would prefer, a common man on the road would prefer for a alternative medicine would be the benefit, he is convinced about the benefit and the safety of the alternative medicine as such. The alternative medicine in general, I am not suggesting only Ayurveda, from Indian point of view it is Ayurveda, but throughout the globe, alternative medicine is in demand for a quite a significant time, and the demand is increasing, and this is one of the major issues which has drawn the attention of the contemporary medicine experts as well as policy makers. All that medical policy is dependent upon the public opinion, and it's now known that the demand for the alternative medicine throughout the globe is increasing, including the developed nations like US, and as per the data, it is expected to be very high by around 2030 with a high annual growth rate, comprehensive annual growth rate of 23.9%, which is very significant commercially. From Indian point of view, our point of view, even demand for Ayurveda in India, as again from the different sources, and the sources are mentioned here, the demand is increasing and it's quite obvious, and it's expected by 2022 it has reached to $8 billion as such. Naturally, the question comes in, who uses the alternative medicine and who recommends the alternative medicine? This question comes in from, and I am just dealing with the context in the Indian situation. There are a few such peer-reviewed studies done on these issues, surveys done on these issues. One of the very rather huge amount of survey, or rather a huge number of a huge survey done, the references were R.V. Gupta and Ghosh published as such, and I have collected the data from that. The doctors prefer the alternative system of medicine in India, and among these alternative systems of the medicine, Ayurveda tops most by the patients, and next is the homeopathy. Ayurveda and homeopathy are the most two important alternative medicines which are preferred by the common man. The other are yoga, home remedies like what we call as folk medicines, Unani and so on. The other systems also are used as such. Now, the reasons why the people would be using this, again based upon, from Indian point of view, based upon the survey of the same referred survey, the Ayurvedic or alternative medicine is believed by the people as more effective by about 55% of the people and safer. Then of course you have all the other reasons, like they may be used by advice of somebody else, family medicine. But the two important issues which I would be stressing upon is the people perception of the people that alternative system medicine is effective and safe. All the other persons, of course, perceptions are true as such, and that's one of the issues. But from our point of view, from clinicians' point of view, we have to consider these two as points, which is absolutely necessary to keep our momentum in the area of practicing as such. Because all that, whatever we have to do, is based upon the public demand. Because lokayavahi acharyaha buddhimatam, that's what Charaka has said. And in general, the survey, the opinion of the people who are using this alternative medicine from the common man is that way. Some of the modern doctors also do use alternative medicine many a times, Ayurvedic including, and the survey, that opinion was taken by the same survey, in the same survey of the doctors, modern doctors. Some of the doctors who are utilizing Ayurvedic medicines and they have surveyed about 116 doctors all over the India, and 84 doctors who are not using alternative medicine, and their opinion, like whether alternative medicine like Ayurveda is beneficial or not. Now, the opinion between the doctors who use the alternative medicine, Ayurvedic medicine in their practice, and the opinion of those doctors who are not using the alternative medicine, it has a very huge significant difference. Doctors who use Ayurvedic medicine believe that the Ayurvedic medicine is beneficial, Ayurvedic or alternative medicine, and they around 60% have recommended the use of alternative medicine. As such, a few of the doctors, around only 51 or 44% of the doctors would be referring a patient to a non-allopathic practitioner, or they may be prescribing the Ayurvedic or alternative medicines by themselves. Whereas the opinion of the non-utilizing doctors is quite significant. So there is a big gap, a huge gap between opinion of the learned people or experts in the medical field. The common man's opinion is something different. The view of the medical experts, so doctors, is a significant different there. Now, the same survey, another survey of the reference is over here, and in that they have taken a survey of why the allopathic doctors do not allow cross practice. That's a prescription or use of alternative medicine along with the modern medicine. For this, they had taken a survey of a huge number of doctors, and the opinion by the modern doctors. Now, this is the modern doctors, like the majority they have not responded, and a good number say that they do not have a knowledge about the drug and drug interaction. So, one of the issues of concern is the present day's medical system in India. Now, I am just focusing on the Indian situation. The modern medical system and the Ayurvedic medical system, they are two absolutely watertight compartments. And the persons in the modern medical field, they are having absolutely no knowledge of the Ayurvedic drugs or Ayurvedic medicine protocols. And that itself could be one of the causes why they are not using the Ayurvedic medicine based upon this opinion survey. The others, of course, other opinions like Ayurvedic drugs do not undergo scientific testing, and there are better, the modern medicines are better than that. These opinions are comparatively minor as such. The major issue is there is a lack of synthesis, lack of the knowledge which is transmitted through, or which is crossing across the groups as such. Then reasons given by allopathic doctors for allowing cross practice. Why the doctors use the cross practice or use the other medicine, system of medicine along with their practicing medicines? The response is they are using only, and again a minority of the modern doctors use the alternative medicine, and the percentage of them use, or the conditions where they use is again only a few of the patients, only a few conditions that they are used, and they may be using it only after having some training about Ayurvedic doctors, and a few of the people, very few people believe that integrated management is better than the other way as such, and they say that it's only after proving. And in rural area, they want to impress the people with the Ayurvedic medicine because it is popular or is perceived by the people. Now, why the people would go for alternative system of medicine or Ayurvedic medicine? Now, that's about whatever we have discussed is the view of the experts. Now, the common man would be using these Ayurvedic medicines or alternative medicines as such, would be that they feel, a good number of people feel that alternative medicine combined with the conventional medicine would help. That's the perception of the people, and it's around 54.9%. And then, of course, the other reasons which are not very significant is some of the people may consider this as interesting, some may consider that conventional medicine would not help, or conventional medical profession suggested it, and so on. That's not the issue. The important issue which we have to be bothered is or which is the major view for the policy makers is there is a huge public perception that the combination of the alternative system of medicine with the modern system of medicine would be quite useful as such. Now that's about the total environment or the ecosystem of the two medical systems, and of course there is another absolutely very popular view that Ayurvedic doctors or the alternative system doctors, they are using too many modern medicines, and at times in the name of the integration the identity of the Ayurvedic doctors is lost. This also is true. Of course we do not have any official data collected about this issue, but practically this is one of the situations which is really a matter of concern, and many times the policy makers are really concerned about this issue, like when a Ayurvedic doctor or when I say alternative or Ayurvedic, I don't make out that difference because in the
recording in progress.
the Ayurveda, which is the major issue, and the Ayurvedic medicine point of view, the majority of the Ayurvedic practitioners who are using who are permitted to use contemporary medicine, they have lost the identity and they are overusing the medicines or wrong use of the medicines, and a lot of negative publicity about the integration does exist, and it is a real issue. Rather, the more important visible issue is about the negative publicity about the integration than really the other way. Now in that kind of a situation, there is a responsibility of all of us, particularly those who are coming from the Ayurvedic stream, and then we are concerned about the total welfare of the patient. We need to substantiate the real use of this. Now from my clinical point of view, though the number of patients whom we have treated with these kinds of treatment could be quite huge, I am just trying to point out a few of the very critical conditions, important conditions which can substantiate this. Now I am just referring to one of the patients whom we have treated. The patient had a gangrene developing in the foot. Both the feet had the gangrene developed after the serum injection, and he was treated. The patient was treated in a government hospital in Mangalore initially, and there was a recommendation for amputation of both the legs, below knee amputation of both the legs. The patient had developed the extensive gangrene in both the legs. Now as the patient, and this was recommended in the modern medical hospital. Now as the patient was not willing to undergo amputation of both the legs simultaneously, naturally an issue of real psychological impact, patient preferred an Ayurvedic treatment, and they came to our hospital, and the date is 16/1/2022. The treatment protocol which I have done is, of course the patient was given a course of antibiotic, and I always preferred that the older antibiotic like gentamicin, and the patient was given Manjastalic Sharabasti from Ayurvedic point of view, and the patient was treated with the Triphalakvata Parisheka, and gradually there was a slow debridement done, and by around a month the patient could save the limb except for the toes. The toes were, of course, they needed to be amputated. The stump had a good healing and the patient recovered well. Now, of course, the last photograph of the patient's complete recovery, of course, I couldn't get that photograph, but the patient now has a foot with, of course, only the toes removed, but patient can walk with the foot, and this is the real utility of a combination of the drugs. Now another of a similar case which I would be again recommending to or referring to would be another patient, a young patient who met with a road accident, and he had a crushing injury in the lower limb, and he underwent an amputation. He went to a modern hospital, and he underwent an amputation at the ankle initially, and within a few days the stump had become necrosed, and then again the patient was having a revised amputation of below knee amputation, second amputation, and after a few days they found that the second amputation also was having necrosis, because the Doppler study later showed a thrombosis of the femoral artery, a complete blockage of the femoral artery, and the stump was thrombosed. And at that situation, the patient came to our hospital with the completely dehisced the stump and a gangrenous changes over the area, over the stump. Now, interesting issue is that patient was treated in a very sophisticated modern hospital, and the doctors who recommended the third amputation, they had suggested the third amputation above knee. The patient was not ready for that, and of course the patient had lost also the sufficient amount of money and they didn't have the resources. And when the patient preferred to go for an Ayurvedic hospital for the treatment, the medical team in the other hospital, they were discouraging the patient, and they had undertaken a bond, a indemnity bond, a double, two specific indemnity bond, that the risks involved would be quite huge, and the person who is taking the patient back to the Ayurvedic hospital is responsible for that. So there was a lot of discouragement and rather a negative view given by the medical profession at that situation, but somehow the patient came against the medical advice. Patient left that hospital against the medical advice and then came with that situation, and on the day when the patient visited, the appearance, you can see the stump had dehisced, the flap of the stump was just necrosed and lot of necrosed tissue was there, and the gangrenous changes were seen at the stump on the day when the patient was admitted. Now in that patient again, we tried with the same Manjashari Ksharabasti, and gradually the stump showed a signs of vascularity, and the whole slough could be easily removed. The slough could be removed, and by day there was a good amount of vascularity, blood flow could be seen, and I just sutured without the third amputation. The wound was resutured and the patient had a good recovery, and the patient would walk with the support as such. Now that's one of the area. It's not that the whole issue is highlighted. The point which has to be concerned is a patient who could not be managed with the limb saving attitude for the patient benefit with the contemporary medicine, but when the same was combined with the Ayurvedic protocol of the Ksharabasti, Manjashari, the patient could recover and the wound could heal, and the result is significantly better for the patient. And in that kind of a situation, the issue is the patient is the uninformed patient, a patient who doesn't have the exact knowledge of what can be done. He prefers an alternative line of treatment like Ayurvedic treatment on reasons which are beyond the real medical reasons. It's not the medical experts who have suggested him to go to the Ayurvedic treatment. Instead, because he had no resources and he felt bad with that situation of second amputation or bilateral amputation in the first case, patient preferred to Ayurvedic treatment, almost in a situation where he had lost the hopes as such, and simply as an alternative resource they have come over there. Suppose the situation could be something different, where we would have a national system of medicine where the benefits of both, benefits of the contemporary medicine as well as benefits of the Ayurvedic medicine, they are combined together, and the limitations of the modern medicines are known to the medical expert, and the medical expert would be either preferring to use these alternative system techniques like Manjashari Ksharabasti or any such protocols. In the same setup, that the patient would be benefited much better. That stress of visiting to the two hospitals, stress of going against the medical advice, the cost involved, all that could have been saved if there would have been an established system where the advantages of both these systems were to be given under a single roof. Now that's the important point which we have to consider and which we have to highlight also from the point of view of the policy makers, impressing the policy makers. Of course, we can go on giving such hundreds of such examples of that sort, but I am just highlighting about certain of the major issues, major areas where we can produce a huge change. Like one of that is the chronic wound healing. In the chronic wound healing, the contemporary medicine often fails, particularly in the venous wounds, venous ulcers, stasis ulcers, and in such conditions, simply use of Triphala Kvarta in the wound can produce a huge dramatic change. The triple aquata can be used in a wound with the slough, very simple remedy, along with whatever the systemic medicines which you may use depending upon that, and the wound may show that there is a significant bed, a vascular bed formed, and then it can be integrated with the skin graft, and with the skin graft the wound can heal much better, the outcome can be better. Another of the example of integration of the technique of the skin graft over the Ayurvedic medicine protocol. The earlier situations were a modern medicine treatment, then the Ayurvedic medicine protocol is done. And this is an example of initial Ayurvedic medicine protocol, then the skin graft and the wound has healed. Similarly, in case of wounds with the slough, huge slough and fibrous wounds, a total revision of the wound bed can be done by the Kshara application, again which is very popular. Kshara application in the wound is very popular, and there could be a significant de-sloughing and the wound can heal and we can produce a significant change in the outcome. So many of those intractable conditions which otherwise cannot be managed easily. And the conditions, of course, where we can have this kind of integrated approach as a game changer. In almost every disease, it is quite possible that a judicious use of the contemporary system as well as Ayurvedic system together can produce a huge change in the outcome. It can benefit the patient significantly. It can reduce the cost of the treatment. It can reduce the duration of the suffering. It also can reduce the possible adverse effect of the medical treatment asset. And the number of such diseases are quite huge, and a good number of patients whom we treat in our hospital setup are the lifestyle diseases like diabetes, obesity, etc., COPD, coronary artery disease, autoimmune disorders, degenerative disorders, common day-to-day conditions like upper respiratory infections, GI disturbances. Disease prophylaxis protocols, many of those diseases where you can prevent the disease conditions, there again the combination of these two issues can be quite frequently used, particularly the health promotion aspects of Ayurvedic treatment like Swasthya protocols. They would be very beneficial in preventing the disease conditions, and the health guidelines, promotion of the health guidelines also is one of the issues. From the surgical management point of view, number of surgeries required can be reduced significantly when we use the alternative system of medicine. This is the data of surgeries and the OPD patients whom I have seen in certain conditions, the official, the standard collected data. The number of hemorrhoid patients whom we see now in the hospital is quite huge, but the involvement, the surgical interference is only in a lesser number of that. Majority of the patient can be managed without surgery, and that avoidance of the surgery itself is one of the major contribution, and this can be done by having Agni-Dipana Anuloma therapy along with in the initial stages. By that, surgery can be avoided, whereas contemporary system of medicine has very little to contribute at that initial stages, and the surgery can be avoided. That avoiding the surgery is possible when you use this kind of a judicious approach of Ayurvedic medicine as well as the contemporary system of medicine is surgery when it is necessary. Similarly, appendicitis, the same issue, the number of patients whom we treat conservatively is much more, whereas the number of surgeries could be lesser. And this gives a boost to the patient, and the indications for the surgery itself, the guidelines for the surgery itself can be raised, that benchmark can be raised lesser. And the present day, I do the surgery only in those patients who have come with the acute appendicitis where the total count is more than 17,000, or the patient has a complications like rupture. Otherwise, majority of the patient can be managed conservatively with our Ayurvedic treatment protocol. Similarly, avoidance of surgery or the changing the benchmark of surgery is possible in large number of patients, particularly from the data, again, though I may not have that, I may not be able to present that the specific data in terms of the standard list data. The number of patients whom we can treat with the combination of this Ayurvedic treatment protocol and avoid the surgery are huge, and the majority of them are like IODPs, cholecystitis conditions, renal calculi, prostatic hypertrophy, ischemic heart disease, diabetic foot, varicose veins, peripheral ischemic disorders are the major areas. The guidelines for surgical indications can be modified now, and it's a surgical spinal surgery can be avoided only when there is a motor deficit surgery may be needed. The benchmark for the surgery in BPH can be raised up to 200 ml of residual volume, whereas the standard textbook guideline would be suggesting about 100 ml as the criteria for the indication of surgery. The cholecystitis, only with the calculus cholecystitis, valve thickening of more than 14 mm requires surgery, otherwise we can be managed with the medicines. A huge number of diabetic foot patients where amputation was recommended. The amputation can be minimized, the amputation can be reserved only for as a last resort when the patient doesn't respond. So this way the total outcome would be significantly better, and this helps in the spectrum of the patients who visit to the hospital. Now this is one of the issue which I will be highlighting as such. In general, generally, if you go to any Ayurvedic hospital throughout anywhere in India, only a few of the patients who prefer to go for Ayurvedic treatment, and the patients themselves would have a perception. The society has a perception that for the certain diseases the Ayurvedic treatment protocol is good, and hence the patient prefers the Ayurvedic treatment protocol only for such conditions like maybe the chronic painful conditions like osteoarthritis or stroke as such, and so on. But the spectrum of patients would not be covering almost all the spectrum in general. But in our hospital, SGM Ayurvedic Hospital, because of this kind of an approach where both the systems could be used for the benefit as such, the spectrum of the patients, variety of the patients who come in is almost the same as that of any modern contemporary hospital, which involves all that conditions, though the stroke related osteoarthritis, rheumatoid conditions are very commonly seen, but all other surgical conditions, trauma and other casualty conditions also make a huge presence there, and hence it substantiates the fact that once we provide the service and the patient, the society is convinced about it, the society will accept the therapeutic protocol where the benefits of both the systems are given to the patient, and the social acceptability is one of the important issues. Now, instead of going for this kind of a situation where we have two systems separately existing, like an Ayurvedic hospital and then a modern medical hospital, and then a Ayurvedic hospital which gives the service of this integrated system, which is often criticized by many people, it's absolutely necessary that we have to have a national system of medicine where benefits of both these systems are given to the public, where there is no need for the uninformed persons to be in a critical or in a confused situation like where to go for the treatment. Now, whether this national system of medicine is a dream or not, the ideas of national system of medicine is not simply a issue which is concerned in our situation, Indian situation. It's the whole world is knowing about it or is concerned about it. China has taken a lead, and then it has already established a significant national system of medicine, and the WHO has also is having some idea of this kind of an integrated traditional system of medicine which could be suitable for each of the countries. So a development of a national system of medicine for the specific country also is one of the agendas of the WHO, and the Beijing protocol of the Beijing Declaration of 2008 is the issue or one of the major declaration where the idea of developing the system which is suitable for national health system to ensure appropriate, safe and effective use of traditional medicine was one of the agenda, and all the countries are advised about developing specific national system of medicine. At present, in the global situation, China has developed a really a practicable national system of medicine, whereas what we see in India, though the seeds of the national system of medicine started before independence, the Indian National Congress had declared about the possibility of a national system of medicine in combination with the Ayurveda, Unani and modern system of medicine, and this was declared 105 years ago in 1920. But, and it's not only that, you had a series of such these declarations about the utility of this integrated system, or a system where the advantages of both these systems can be put together and a national system is developed. And the Boer Committee in 1946, that is 79 years earlier, had recommended a similar issue of services of persons trained in the indigenous system of medicine should be utilized. But central government in 1948 came to a decision which was based upon Chopra Committee's report, that this kind of a combination of medicine is impracticable, as the theories and principles of modern medicine are very different from the theories and principles enunciated by Ayurveda and Unani. Now, there are good number of committees which have recommended an integration. Chopra Committee in 1948 recommended that it should not be done, and the central government took the decision like in 1948 that it cannot be utilized, and hence the systems are kept separate. But the stream of this kind of a situation where the suggestions for, recommendations for Ayurvedic, this combination of these different systems continued in the series of expert committees planned at different levels. And Mudaliar Committee in 1961 again recommended the same issue in different languages, like the modern medical colleges and the Ayurvedic medical colleges, they should be having interaction and the training should be available for Ayurvedic doctors as such. And the Srivastava report in 1975 also is about the highlighting the need for a national system of medicine in the country and an integrated relationship between modern and indigenous system of medicine. And 1981, the study group, the medical research study group, also has recommended the same, like bringing together the best of traditional and modern science into integrated preventive and promotive curative system. National Health Review Committee again in 1983 also has stressed upon the need for organizing measures to enable this traditional system of medicine to become the mainstream of medicine. And in National Education Policy of 1989, the Bajaj report 1989 also has stressed upon the same issue, and it's around 36 years like. And the report of expert committee on health systems in 1996 also has recommended the same issue. Practitioners of Indian system medicine can be gainfully employed in the area of national health program. And the National Health Assembly of Civil Society Organization in 2000 also has supported the traditional healing systems, including the local home remedies along with the mainstream medicine. In 2002, again the National Health Policy has again noted under the whole overarching umbrella of National Health Framework, the alternative system of medicine, Ayurveda Unani system should be substantially included, which is not tapped as such. The National Rural Health Mission in between 2005 to 2012, in its vision statement itself, has suggested like there should be a national system of medicine which includes the Ayush system of medicine to the public health system. 12th 5-year plan has recommended recommendations of strengthening the Ayush hospitals. At the same time, to meet with the legal and ethical challenges related to the medical health pluralism or combination of these drugs, the legal issues. There are one of the issues of concern now is legal issues. The 12th 5-year plan has recommended that it has to be dealt with. But the real development in the direction of integration, though there are some changes, I am just not going into the detail, the history of that and the experience of that is known to all of you. But a real milestone development in the direction of integration has come up very recently, and in May 2025, the Ministry of Ayush and WHO, they have combined together, and a WHO Global Center for Traditional Medicine is established in Jamnagar with the idea of strengthening the evidence-based traditional, complementary and integrative medicine as such. Though it's just the beginning. The point is, it's now Dr. Raman Singh suggested me to speak about the success story of integration. Now, this of 100 years, like whether this 100 years history is suggestive of a success or failure, I don't know. But well, there is a rather beacon of hope, like there is something like a significant movement in the direction by the policy makers when we see this WHO Global Center of Traditional being established. Now that's about the policy as such. As far as the traditional, these training issues, there is a very important issue of this combination of the system is the training. From the history point of view, of course, Ayurvedic history is a Gurukula system where from Sushruda's period itself, or Charaka's period itself, the training was in an institutional form and the student was exposed to all the possible alternative choices at that time, though there was no such system as such. But from the contemporary Western medicine system and Ayurvedic medicine, 1822, the Calcutta School of Native Medicine was started, but the same became a modern medical college later on, converted into medical college as such. And the traditional system, Ayurvedic treatment protocol or Ayurvedic education was moved on to Sanskrit College in 1835 from the same institution. The medicinal institution developed into a modern medical system. Similar issue is with the BHU, the Institute of Medical Science, established by Madan Mohan Malviya Adaraniya, in 1916, and as all of majority of us are from the products of the BHU, we know the history that the same overnight was changed into a modern medical college, and Ayurvedic system became a department at that in the huge institution. With a hope that there could be a lot of interaction and integration can develop. Of course, there is some interaction, I have not denied that part, but definitely it's not to the expectation of the peers like Pandit Madan Mohan Malviya. The same was converted into a medical science institute, College of Medical Science, and in 1971 only the Ayurvedic department was added. Now the national integration also now has been now added on with the idea of including the Ayurvedic system of medicine into the modern system of medicine, and having this interaction between the system is considered to be one of the aim of the national education policy of 2020. And with that effort now in the some of the medical colleges, particularly in JIPMER, that Pondicherry Medical College, very recently they have started a course where Ayurvedic stream as well as the modern system can be added together. Attempt for introduction of Ayurvedic subjects in the MBBS curriculum was done in some past 2 to 3 years, but very few takers were there. So that's about the story of integration of medicine, which is the real need of the day. The people who speak against this integration, there is a good stream, a very strong argument against this integration of the system, and it's from both the sides, from traditional Ayurvedic doctors' side as well as the modern medicine side. The reasons given by them are mainly the purity of system is artifact, and the perception of Ayurveda and modern system is different. Of course, it is true. I am not saying that the perception is same, but still there is a good scope of the interaction and the benefit to the patient, which we can substantiate. Rates of growth are different, cultural background are different, but the most important highlighted issue is the lack of data. There is no such data which suggests about the advantages of the integration. This is what the people would claim. But there is a hitch in it, there is a vicious cycle or Gordon's knot. To produce the data, it has to be acceptable to the people, and only when the society has accepted, you can produce the clinical data. Clinical data can be generated only when the public has accepted. If we wait for a policy maker to say that the integration integration of medicine is considered to be an acceptable one. To start with this integration practice, then there will be no possibility of the data. Instead, if we establish such setups where the public is convinced, and if the public is convinced, and then the patient, there is a huge number of patients whom we can treat with this kind of an approach is possible, where we will not lose our identity, as well as we will establish the benefit of the integration of the system. Then there can be, the policy makers can be influenced upon, because after all in democracy it is the public opinion which makes the situation, and the hidden public opinion, the stream of public opinion is in favor of the this integration of the system. But as practitioners of medical system, we have to establish, or we have to strengthen that stream which is hidden in the society about the benefit of this integration, and make it as the mainstream and accept as such. And it's not very difficult, though it's a bit difficult, it's not very difficult, it's challenging of course. After all, it's relatively easier, because the patient, a patient who is suffering, who would be, what he expects from the treatment is mainly the relief. And the relief, if he is given a better relief, early relief and long lasting relief by our treatment protocols, necessarily the patient would be, the common man would be impressed, and the public stream would be, or public opinion would be developing. The other reasons, or the patient would prefer, would be like the lesser morbidity, affordability, aesthetics is one of the issue. The common man on the road who is suffering due to the pain is not after the scientific data. Of course, when I say this, I am not denying the value of the scientific data and the journal publications and so on. Of course, they are needed. I am not suggesting about or saying that it's not essential. But a common man on the road who is suffering, or who is really having a confusion about the option of the treatment, or a patient who is helpless and who is frustrated with the treatment protocol he is getting, he is not really bothered about the scientific data. Instead, he will go for a option which is somehow is available. At times it could be a chance factor that he may come for the options of the treatment. But if we establish a system where this is streamlined and presented, the whole issue that options of the treatment in a critical situations are presented in a standardized format, and the centers facilities are available in a nearby center for a suffering public, that would be the real benefit. And the scientific data protocol, data accumulation and scientific protocol would be the secondary issues. That's the important message which I would like as it. Once we do that and the public opinion is defined, then the policies of the democracy would be again as per the public demand. And if we fail to do that, the next generation will not condone us, and hence I say that it is our responsibility to create that kind of a social awareness. And with this, let me conclude. The concluding is a integration of medical system can improve the clinical outcome, cost and efficacy of the treatment protocols. Integration of medical systems resulting in evolution of national system medicine is the need of the day. And the choice of apt treatment protocol should be in the domain of an educated, trained expert than helpless sufferer. And that integration should not be concealed, like somebody say administering a Ayurvedic drug mixed with the modern drugs, like, or such malpractices, or it should not be an opportunistic mixopathy, the one of the common degrading words used by the other system. That should not be. That's also one of the important precautions which are taken. So our approach should be very judicious and with a specific target. With this, let me conclude and thank you for giving me the opportunity. And I hope there will be many interactions. If there are any interactions, I will try to answer any of that. And thank you for the opportunity given.
Very good, Dr. Muralidhar Sharma. Nice talk. Questions are invited. Dr. Parikshit?
Yes, sir. Thank you,
Is-
Muralidhar Sharma, sir.
Thank you.
Really, it was a lecture which covered very broad canvas, sir, from case studies where integration helped to manage the conditions of the patient in the committees, the recommendations to
Sir. Thank you then, sir. Sir.
Dr. Sandeep? Dr. Sandeep? Hello,
So,
Dr. Sandeep?
is here.
Hello?
Hello.
Hello, Dr. Vidyarthi? Dr. Vidyarthi, please.
Sir, I request Dr. Badwe sir to keep opinion on this.
Okay. Welcome. That's nice. Dr. Barve, please.
Yes, actually, am I audible?
Yeah, you are audible.
Yeah, namaste sabhi ko. And respected Muralidhar Sharma sir has told very correctly that the acceptance is very important for the because this is a democracy, and the acceptance is very important. And as all of you know that there are many national institutes nowadays. The in All India Institute of Ayurveda also there are almost 2,000 to 2,500 OPD is there. So this seems that the public is accepting this science, and actually, this is the need of integration. But just for sir was saying that there is ICD scoring was also there. Then again some advancements with the help of the policymakers has been done that Ayushman they are also trying to include in Ayushman Bharat also, but it is not successful yet. Again, some policies also some companies, insurance companies are also providing the insurances for the Ayurveda treatment. So this is the scenario right now, and as sir was rightly said that we have to move forward with the integration with the proof as so many there are so many publications nowadays. So every time they are asking for the publication, but the publication is though the publication is the need, but along with the publication we have to ask the people to come to our institute, visit it, and we will do the integration practice, and we will promote it with the on the different CMEs or different platforms. So then only we can prove, and then only the government will establish as an integrated medicine. So
That's right.
really wonderful lecture which was given by sir, and that's amazing. So I must congratulate as well as thank you, Muralidhar Sharma sir,
Thank you.
for the nice presentation. And we also need your guidance for taking further for the integration of the medicine.
Thank you.
Dr. Varshney sir, Dr. Varshney sir also there.
Yeah. Hello.
Namaste, sir.
Namaste. हेलो
You are audible, sir. Please go ahead.
अरे बहुत अच्छा आपने भाषण सुना अभी डॉक्टर मुरलीधर का। मेरे तो बहुत पुराने सहपाठी हैं वो, और उन्होंने बहुत कुछ उसमें कवर किया। एक्चुअली इंटीग्रेशन इज द नीड ऑफ डे एक्चुअली। और आपके जो मरीज हैं जिनकी संख्या भी डॉक्टर बड़वे ने बताई बढ़ती जा रही है, वो एविडेंस है कि भाई इंटीग्रेशन कितना उपयोगी है। और ये आपकी ईमानदारी पे बहुत ज्यादा डिपेंड है। अभी क्या मैं मेरे अनुभव में ऐसा आ रहा है कि लेटेस्ट जो गजेट हैं जो आ रहे हैं उनका उपयोग वैसे तो बहुत अच्छा है, लेकिन मिसयूज बहुत हो रहा है। जहां नहीं कर तो अनुलोम थेरेपी और बाकी इससे ही ठीक हो जाते हैं। अगर उनमें आप लेटेस्ट गजेट का उपयोग करेंगे, फिशर में उपयोग करेंगे, तो आज नहीं तो कल पब्लिक मतलब को विश्वास कम हो जाएगा भाई ये लोग जो है गलत काम कर रहे हैं। दूसरी बात, आपके व्यवहार से, आपके डिपार्टमेंट से, आपके बिहेव से आपको ऐसा लगना चाहिए कि भाई आप आयुर्वेदिक सर्जन हैं। आप कहीं ना कहीं ऐसा ना हो भाई दो चार चीजें आपने सीख ली और उनका भी बहुत बड़ा कंट्रीब्यूशन है देश में, उनको भी साथ लेना पड़ेगा, उनकी भी उपयोगिता देखनी पड़ेगी, तभी हम जाके आगे बढ़ेंगे। अभी जो नया सिस्टम चल रहा है कि भाई आयुर्वेद और एलोपैथी यानी नया कोर्स शुरू हो जाए, डॉक्टर रूपा ने जब इंस्टीट्यूट भी शुरू किया था, लेकिन आईएमए ने उसका बहुत जबरदस्त विरोध किया। पहले मेडिकल के कार्यक्रम में चरक, सुश्रुत इत्यादि पढ़ाए जाते थे, लेकिन अभी वो तुरंत उन्होंने निकाल दिया विरोध की वजह से। लेकिन जब तक वो उनके करिकुलम में इंट्रोड्यूस नहीं होगा, जब तक वो मॉडर्न वाले आयुर्वेद को नहीं जानेंगे, तब तक उनका विश्वास होगा नहीं। लेकिन आपके जो डाटा है यही उनको विश्वास दिलाएंगे कि देखो भैया आपने रिजेक्ट किए केस, हमने ये केस ठीक किए, और आज नहीं तो कल अगर आप शुद्ध रहे, ईमानदार रहे, तो आपका इंटीग्रेशन आगे आएगा और कोई उसको रोक नहीं पाएगा। मैं समझता हूँ समय की मर्यादा हर एक के लिए है, मुझे भी है। बहुत बहुत धन्यवाद, दो शब्द बोलने का मौका दिया। थैंक यू।
और एक चीज मैं एक्चुअली ऐड करना चाहता हूँ। बहुत सारे देर आर सो मेनी कॉलेजेस, मॉडर्न कॉलेजेस, वो सभी जो है वो फॉर द इंट्रोडक्शन ऑफ आयुर्वेदा, वो अभी ये चाहते हैं कि इंटर्नशिप किया जाए। मतलब हमारे उनके जो लोग हैं, जो स्टूडेंट्स हैं, उनकी इंटर्नशिप आयुर्वेद कॉलेजेस में लगाई जाए। Might be a 6 days, 7 days internship was there, was proposed. But हमें इस स्टेप को भी एक वेलकम करना चाहिए, एंड सभी कॉलेजेस ने एक अच्छे से उनको सपोर्ट करके हमारा एक अस्तित्व उनको दिखाया, तो ये एक और एक इम्पोर्टेंट स्टेप हो जाएगी।
Yes, a good discussion is going on, and I want to add my experience. Yesterday, I was jury at Vadodara Hackathon. Hackathons are such events where government of India gives challenges to new generation, particularly engineering faculty in new generation, and they give problems to them to solve with the help of AI, IT, or other engineering technologies. I was jury there, and I found that ICD coding 11, which includes Ayurveda disease coding, which is very discrete. Fever is pyrrhia of unknown origin. Pitta is other pyrrhia of unknown origin. Hello, hello.
Yeah. You are audible. You are audible.
Okay.
Go ahead.
Okay. So this is very discrete coding, and government of India has also developed Namaste portal. It has also given coding to Ayurveda, Unani, and Siddha diseases. It is under development, and lot to be added in that portal also. So government has given challenge to develop a code so that an interface can be developed between ICD 11 coding and Namaste portal coding, and this integration of these two coding systems will help to uplift Ayurveda on global level, and also the medical issues and all these issues can be addressed to this coding system. So this was a good step, and students are giving good solutions for that. So government is very positive about integration. One question I want to ask, respected sir. Uh, just a Hello.
Dr. Sandeep,
Sir,
Dr. Sandeep,
hello.
can we conclude now?
Yes, sir, surely.
So please go ahead.
Thank you everyone for joining this session. This session was very important as per the today's scenario. And I, Dr. Sandeep Mishram, the Secretary General of Nima Surgical Society, thanking you for joining the session. I thank you, Dr. Badwe sir, Dr. Raman Singh sir, Dr. Murlidhar Sharma sir, Dr. Vashne sir, Dr. Uh, and all the dignitaries who are joined here. I thank all of them to contribute their valuable thoughts to this scenario. Thank you so much, sir.
Okay. सबको नमस्कार.